We have consistently now had, phenomenally high success rates and incredibly low miscarriage rates. And day after day, I actually had a patient crying on the Zoom call with us today because she said she had done 4 cycles elsewhere and had never even gotten pregnant, and they had told her she needed donor egg, and we literally got her pregnant on our first embryo transfer. So, you know what? It's incredible to be able to help patients and individualize their care and do better for them, because I think that's the path forward. Getting people to have individualized care is the way of the future. You cannot keep going through things just doing the same old, everybody gets the same thing approach. It's great for venture capital based programs. It's great for private equity based programs. It doesn't work when you're actually trying to take care of people and optimize their outcomes and minimize their costs. So there is something interesting coming that we are currently working on. If you haven't heard about it already, I am now part of a group called the Excellence Fertility Group, where we kind of cherry pick other physicians or clinics that we want to work with, or allied healthcare workers, and we hold them kind of to very high standards. And we're going to take it one step further and turn it into an ethical sort of body that will propose guidelines for the ethical administration of fertility care, where we talk about what's reasonable in terms of costs and how you should treat patients, and should you offer options and how you should offer them, and what should patients be educated on, how much detail should you give, like really down to the nitty gritty of how everything should be managed. And that way we can hold other places accountable. And if they join, great, then we'll ask them to abide by those standards, and we'll put processes in place, probably through AI, to kind of monitor that. And if they don't want to join, then I guess other people will know what they're all about. So I'm happy to voluntarily submit to ethical principles for the delivery of fertility care. I know my dear friend Fred Zaneku at Tripod Fertility, who's part of our Excellence Fertility Group, would do the same. So, we're really excited to propose those new pathways forward in that new organization. So we're working on the details now, but it'll be up and coming, and hopefully really change the game for everyone, so that those of you who are not coming to clinics, who are necessarily 100% patient-centered, will know whether or not those clinics are willing to follow the same ethical guidelines and principles for the delivery of the care.